So it is day one for Dr. Atul Gawande, and on the first day, still little is known about the venture, including, guys, its name, of course. Gawande says he's been referring to it as ABJ for the three companies behind it, Amazon, Berkshire Hathaway, and JP Morgan Chase, of course. Well, we know it's an independent company, it's headquartered in Boston, and it's not for profit. And though Gawande hasn't yet detailed specific plans for it, some of his goals at the enterprise may be gleaned, as Becky was saying, from both recent speaking appearances and his writings in The New Yorker and elsewhere. Gawande told an audience at the Aspen Ideas Festival in late June that the aims of the company and its billionaire founders are threefold. First, drive better outcomes, improve satisfaction, and reduce cost, not just for the million-plus employees of the three companies and their families, but also in the longer term, establishing models that can be emulated elsewhere. Gawande acknowledged that's a tall order, but he's also laid out a few ways it may be accomplished. First, by tackling misutilization of care, what he called the biggest bucket, and a theme, of course, he explored in the 2009 New Yorker article that famously so impressed Berkshire's Charlie Munger that he sent Gawande a $20,000 check sight unseen. Next is pricing, and finally, high administrative costs, much of which Gawande said are driven by middlemen. Now, that focus has shaken stocks of the drug supply chain, distributors, and pharmacy benefits managers, though analysts in that space largely noted Gawande's appointment with a sigh of relief. Investors, they said, didn't see him as much of a threat because of his lack of experience running a healthcare system. And that's the biggest knock on Gawande as he starts this new venture. He's a surgeon, a public health researcher, and of course a celebrated author. But I spoke with Andy Slavitt, who ran Medicare and Medicaid in the Obama administration, who said it's Gawande's lack of affiliation with any sector that's a strength. And really,
that's what I would argue too, because in talking with Bill Gates, Warren Buffett, and Charlie Munger back in May, they all pointed out, and by the way, Charlie Munger's had a lot of experience running a hospital. They all pointed out that the concern you get into is this idea of silos. If you pick somebody from one silo or another, they will see the places where you can cut the fat from the other areas, but not from the silo that they come from.
Yeah, that's what a lot of people were saying. If they chose somebody who's already worked in the system, maybe they would slightly improve part of the system,
but they wouldn't be a radical
dramatically change the system. And that's what people are really hoping this can do.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.